Bismillahirrahmanirrahim. These are the important questions which can come in your exam and which can be asked to you regarding the lower limb. Question number one is, I'm giving you few examples. The scenario based questions can be asked in your exam. Question number one is, a 19-year-old football player presented with pain in the back of his thigh and difficulty flexing his knee after a sudden sprint. Name the muscles injured and what are the antagonists of these muscles. Name the nerve supply of the injured muscles. Now the injured muscles, which are the knee flexors, are biceps femoris, semitendinosus, semimembranosus, and antagonist muscles, those are knee extensors, are namely quadriceps femoris group, that is rectus femoris, vastus medialis, vastus lateralis, vastus intermedius. And the nerve will supply these muscles and that is injured in this scenario, in the above mentioned scenario, is tibial nerve, except short head of the biceps femoris, which is supplied by the common fibular nerve. Question number two is, a 40-year-old man complains of difficulty climbing stairs and rising from a seated position after a pelvic fracture. This is a very common and a very important question that is asked to you in your SAQ. That is very important from SAQ point of view and from OSPI point of view as well. And in your OSPI, maybe a Trendelenburg position can be given to you, and the muscles injured and the nerve supply can be asked to you when we talk about the OSPI part. Now come to the question SAQ part. That is question number 2, part A, is asking you the muscle most likely weakened, which movement at the hip is most affected, and what is the nerve supply of the affected muscle. And the answer is, affected muscle is gluteus maximus, and the movement that is affected is extension of the hip, especially when forceful like rising or climbing. And the nerve that has been injured is inferior gluteal nerve that supplies the gluteus maximus muscle. Question number 3 is, a 30-year-old man presents with foot drop and loss of, and there is a loss of dorsiflexion following a fibular neck fracture. Okay, now when you talk about the fibular neck, the key point is here is the fibular neck. And when you know the fibular neck, common fibular nerve, or which is also known as peroneal nerve, is present. So when we talk about the fibular neck fracture, so common fibular or peroneal nerve is most likely to get damaged, and which has been asked to you in question number 3, part A. Part B is asking you the two muscles which are affected, and the C part is asking you about the loss of sensation of the skin part. So the answer is common fibular nerve, and the affected muscles are tibialis anterior, extensor digitorum longus, also the extensor hallucis longus, and sensory losses on the anterolateral leg and dorsum of foot, excluding the area between the first and second toes, which is supplied by the deep fibular or deep peroneal nerve. Question number 4 is, a girl while playing barefoot accidentally stepped on a thorn. To take out the thorn, she sat and moved her foot inward. Which muscles were involved in the above mentioned movement of the foot? Name the antagonist of the involved muscles. Name the joints at which the involved movement occurs. So the muscles are tibialis anterior, tibialis posterior, and extensor hallucis longus. And the antagonist muscles are peroneus longus, peroneus brevis, and peroneus tertius, and the joint at which this movement takes place is subtalar and transverse tarsal joints. Question number 5 is, a 5-year-old unvaccinated child was brought to the OPD with complaint of difficulty in standing and walking. On examination, his right pelvis sank while moving the foot off the ground. Which muscle were involved in the above condition? Which nerve supply the involved muscle? Explain the action of the above mentioned muscle, which I have this scenario has been also given in the upper part. Also you can write down the which muscle is damaged: left gluteus medius and minimus, and which is supplied by the superior gluteal nerve. And the function or the movement of these muscles are, it abducts a thigh, it abducts a thigh, it abducts the thigh at the hip joint. Sorry, there is some It abducts the thigh at hip joint, tilts pelvis when walking to permit opposite leg to clear. That's it.